My name is Sophia Cicerello, and I will be doing my presentation on hyperthyroidism. Hyperthyroidism, also known as Graves' disease, it's an autoimmune disorder that causes the immune system to attack the thyroid gland. When this happens, the thyroid gland produces too much of the two hormones produced in the thyroid gland. This is thyroxine, or T4, and the triiodothyronine, or T3. You will also commonly hear it called an overactive thyroid. An overactive thyroid nodule is the cause of this condition, also called thyrotoxicosis, which is having an excessive number of thyroid hormones. When this occurs, a single nodule or lump grows on the thyroid gland and produces the extra hormones. This nodule is a non-cancerous lump, which can make the thyroid bigger than normal. This condition is called toxic adenoma. An increased amount of iodine in the body can also attribute to the disease. Too much iodine can produce the extra hormones that causes hyperthyroidism. Your thyroid uses iodine to make the thyroid hormone. How much iodine you consume affects how much thyroid hormone your thyroid makes. In some people, consuming large amounts of iodine may cause the thyroid to make too much. This is also called an overactive thyroid nodule. Nodules are not very common, but the chances of developing them does increase as you get older. Symptoms are not always common, but a very large nodule could cause pain and hoarseness or get in the way of swallowing or breathing. Everyone is different and may not have any symptoms or just a few. Symptoms can start suddenly or come on slowly over time. Some of these symptoms include sweating, an increase in hunger, weight loss without even trying, and irregular heartbeat. Increased sensitivity to heat, tiredness, muscle weakness, or sleep problems. Hyperthyroidism looks like it can be another health reviewing medical history. Also with blood tests and thyroid ultrasound can help diagnose the condition. Other factors to consider would include a family history of this condition, a personal history of certain chronic illnesses, heart problems, brittle bones, vision problems, and discolored swollen skin. There is a treatment for hyperthyroidism, and that would be to take an anti-thyroid medication. What that will do, it slows down the symptoms and prevents the thyroid from producing too many hormones. The other would be a change in diet to consume less iodine. There is a milder form of hyperthyroidism called the subclinical hyperthyroidism. Some people may have symptoms, but many people will not have any of these symptoms at all. The same tests that are used to diagnose hyperthyroidism are to diagnose subclinical hyperthyroidism. And in many cases, the subclinical hyperthyroidism is monitored. And it's up to you and your doctor to decide whether to treat the condition depending on what is causing it. The prevalence of the hyperthyroidism in the United States is approximately 1.2%. The outlook or the prognosis of hyperthyroidism is treatable. Some cases may go away without treatment or by simply changing your diet. While hyperthyroidism is caused by Graves' disease, usually it gets worse over time. It has many complications and some which are severe and could affect the quality of life.